the relationship is so important in therapy. Like when you look at the ingredients of people doing better in therapy, like relationship is so key. And I imagine like a lot of people wonder, can I build a relationship with you, Mark? You are a
Hmm.
stranger to me if I'm like coming to your practice. Can I build a relationship with you over video, or should I just wait until all of this shelter in place lifts and I can like see you in person? And what would you say to folks who are thinking, like I'm ready for therapy? Should I wait till it's in person, or should I just like go for the video version right now?
Well, I think there's a couple answers to that question. The first is how urgent is this issue? I mean, if you're having a mental health issue that you need to have addressed right now, and there's not a therapist that's available to see you in person because they're not seeing patients in person in your area, then what I would say by all means, telemental health is certainly a great option. I think that the other thing, if your issue isn't urgent, you want therapy, but you think it can wait a little while, it really depends on your comfort level and what it is that you're looking for. I think that there is a learning curve and a comfort. I'll call it a comfort curve in terms of starting treatment. But what I have found, quite honestly, is people who have sought treatment for me or with me for telemental health, or people who have been forced to do it because of the COVID situation, have actually eased into it very well. And it's actually been, I think, for them and for me, surprising how easy it's been, and also how that relationship hasn't really been affected. As I said before, there's patients that I've seen and helped, I think, helped tremendously, who I have actually never met in person, never laid eyes on. And I would say that our relationship is just as strong as it would have been with somebody that I would meet in person. I think it's partially a perception issue. How is this going to work? But I think that if we think about, I mean, I think there's a lot of parallels here. But we think about Uber. Like 7 years ago, or 8 years ago, none of us would ever have thought about pushing a button on our phone and getting into a stranger's car. We would have thought that was like off the wall. And now we do it. Well, we used to, and hopefully we will again do it on the regular. And so I think the same thing is true for telemental health. 5 or 6 years ago, we would have thought it was really strange to see a psychologist over video. But now, with the changing times and the changing technology, I think it's become much more accepted. And I think that people are really, finding value in it.
I love that answer. And the first part of it, you said, how urgent is it? And I'm wondering if there are ways you can give folks who are listening, like ways to assess that. Because I think sometimes it can be actually hard to know like when to seek care and when to kind of wait it out.
Yeah.
Are there things that people can do on their own that would help them assess that?
Yeah, I think that the first thing to do is ask yourself, how much is the issue that I'm dealing with impacting my ability to function in the world? So how much is it impacting my relationships with my friends, family, significant other? How much is it affecting my ability to go to school or to work? How much is it impacting my ability to live my life? And granted, I understand that right now we're in a strange time, but that's the biggest, that would be the biggest thing I would think about. And because if you're having trouble going to school and having trouble, functioning at work, then I would say that's a sign that you need some help, and probably need it soon, because you have a pain point. You need to have that pain point addressed. If you're or with a diabetes specific example, if you're having an issue where you're emitting insulin to lose weight, or you are running your blood sugars really high because you're scared of low blood sugar, those are things that are relatively urgent. And of course, if you're thinking about hurting yourself or have suicidal thoughts, that's another red flag. Although we'll talk about that in a minute related to telehealth, because that's a challenging situation. If you feel, I'd really talk to somebody about issues from my past, or about my diabetes diagnosis, and trying to kind of come to terms with that. I would say that in general, that's probably a less urgent thing, but certainly it's something that needs to be addressed, and so something that can be put off. But I think the big thing that I would look out for is, how is this impacting my daily functioning? am I able to do the things that I need to do to live my life effectively and to pay my bills and to, have relationships.
Yeah, I love that. Is there, for some of the common mental health stuff that you see, I mean, there's
Mhm.
lots of good depression screeners. Are there any you recommend? I mean, depression, anxiety, diabetes, distress.
Mhm.
Are there ones that you would send people to just sort of get a sense of like how clinically severe or not things are?
Yeah, so I usually send people before they come in to see me the PHQ-9, which is a 9-question depression screener. I also will send them the diabetes distress scale to see how they're doing with diabetes, because everyone that I see has diabetes, and so we want to kind of see how they're functioning in related to diabetes distress and how diabetes distress may be impacting their lives. But honestly, I would say that for patients aren't I would really caution against people self-screening with self-administering these tools. They're available online, but I think that just asking yourself the question, how am I feeling and how am I functioning is probably sufficient to know whether or not you need treatment. If you want to do the screeners, want to do the assessments, then that's great, but I wouldn't put too much stock in it, because you really need to understand kind of what it's looking for to really get some value out of it.
Yeah, well said. What about finding a therapist? So this is a whole big topic, I think, and I think sometimes people with diabetes, if issues relate to diabetes, there can feel this pressure, like I need to find a therapist who has diabetes,
Mm-hmm.
and I'm wondering, like, well, one, what are your thoughts on that?
Uh-huh.
And if I can find a therapist who has diabetes, which I'm sure you'll address, how do I assess if someone will be a good fit for what's going on for me?
Yeah, well, in terms of finding a therapist, you really want to you want to really ask yourself, what am I looking for help with? And if your issue is diabetes specific, so for example, you're experiencing diabetes burnout, or, fear of hypo or hyperglycemia, or trouble adjusting to a diagnosis, having someone who understands diabetes, I think, is really important. The person by no means has to have diabetes. I know lots of wonderful therapists who work with people with diabetes who don't have diabetes, but they're diabetes knowledgeable. And I think that's important for a couple of reasons. One is that some of these issues are diabetes specific, and so a therapist who doesn't have that expertise isn't going to know what to look for, and they're not going to be able to really address the issue appropriately. And the other thing is an issue of language and connection. You want someone who's going to be able to ask the right questions and to be able to use the right language. And so I get a lot of people who come to see me, and they say, well, I went to see a different therapist who didn't understand diabetes, and I spent a lot of the time in my treatment session explaining to them what diabetes was and what it means when I say that I was scared of, or my blood sugar went low, or that I forgot to take my Lantus, because they had no idea. And that language barrier is a big issue. If you, on the other hand, though, if you're seeking treatment for a non-diabetes related issue, I think that there's no reason why you need to have a therapist who has diabetes or even understands diabetes. There are actually some great resources. Beyond Type 1 has some great resources for therapists who are seeing patients with diabetes for non-diabetes related issues, just to give them a general rundown about what Type 1 diabetes is, and what types of things to look for. But for patients who aren't seeking treatment for something specific to diabetes, I'm not convinced that that's really necessary, especially because there aren't very many people who treat diabetes-specific issues. In terms of finding a therapist, the best resource I have right now is the ADA, APA, mental health, diabetes mental, I can never remember how to say it, the provider directory. For those of you who don't know, the American Diabetes Association partnered with the American Psychological Association about 3 years ago to develop a training program for mental health providers to give them the basics about diabetes and mental health. So it's a one-day training program with some follow-on video work that gives a general rundown about what diabetes is, how it's treated, as well as an overview of diabetes specific mental health conditions. And people who complete that training are now listed on a website, on the the ADA's website. And you can do a search based on location, based on state, based on seeing adults or children, and a variety of other things, including telehealth and whether the provider does telehealth.
Yeah, that's awesome. It's been interesting for me because I'm in school to be a therapist right now,
Mm-hmm.
and the training, every strand of training like has aspects that apply to diabetes, but of course, like we don't cover diabetes as a diagnosis, but we certainly cover things like depression and anxiety in great depth, and a lot of those touch diabetes. And I think what you were alluding to is like, if the problem, if diabetes is something in someone's life, but it's not like driving the core problem, like the therapist sort of needs to keep it in the back of their head as like one of many variables that might be affecting the person. But if it's like the core thing, then that's a different story, I think is what I heard you saying. And that nuance is really important.
Yeah, I think that, and there's one more thing I would add to that, is if it's the core thing, then yes, or if it is something that is having a big impact on someone's ability to manage diabetes. So let's imagine for a minute, just hypothetically, that somebody had a fear of spiders, and that fear of spiders somehow was making it so they weren't taking the long-acting insulin every day. I would say that is a diabetes-specific issue, even though the fear of spiders is not related to diabetes. It's a big barrier to the person taking care of themselves. And so having knowledge about what taking care of yourself means, and how to overcome that barrier in order to get to the end goal of managing diabetes well, that's important. But yes, I think you're right. If somebody has a fear of spiders and doesn't have any impact on their diabetes management, then seeing a therapist like me is probably actually not the best use of someone's time. They should probably, or maybe even my time, because honestly, I'm not trained to treat people for fear of spiders. I can do it, but my expertise is really in how do I help people to overcome the specific psychosocial barriers that come along with living with diabetes. And so, seeing me for that issue, even though you have diabetes, we're probably not the best fit.
And Mark, do you think, so let's say, it's a diabetes thing and I need a therapist who specializes in mental health and diabetes, and yet there's no one near me and there's no one in my state, for instance, or no one's seeing patients, like we could come up with a bunch of reasons. Yep. What about therapists who are like really solid on like disabilities work or really solid on chronic illness? Like, to me, there's enough similarities that like you could make a lot of progress, but I'm wondering if you disagree, or is that?
No, I absolutely agree. If you can find someone who's trained in health psychology, there are lots of psychologists who are trained in chronic illness over the span of illnesses. That's really helpful, because that type of therapist is going to know enough to be able to do the research to understand kind of where the person's coming from and have the theoretical basis for that. Also, I know that myself and also other psychologists who specialize in diabetes are always happy to consult with therapists when the issue that the person's dealing with is diabetes specific and the therapist doesn't have that sort of expertise.